Welcome to our podcast, Sculpted and Unscripted with Dr. Azad. This is an opportunity for Dr. Azad to answer questions that regularly come up during consultations, pre-ops, and post-ops.
Hi everyone, welcome to another our podcast. So today, before I start our topic, actually I'm very excited because we have two great news for you guys. One is I just want to say we're so excited that we were elected one of the few surgeons from the state of Florida. I think there was only 3 or 4 of us that we get to go to Costa Rica and learn how to do the Preserve, the minimally invasive breast augmentation. So that will be in mid-January. I'm gonna give you guys more detail when it comes closer. So that's the great news. The second good news is, which is super exciting, is like I'm gonna try to have at least once a month have another guest, another plastic surgeon, a colleague of mine from Orlando, or maybe even a different city or different state, to come in and join us. So that way we can talk about different things and they can talk about their view of doing same surgery in a certain ways. And also this is a great opportunity for you guys to ask questions, to come up with questions. That this is what we're doing. Essentially, you're getting whatever you're getting at a consultation, you're going to get it here. So that's what we're doing this for you guys. All right, now that we covered that, so today we're going to switch things around. We're going to talk about tummy tuck, liposuction, mini tummy tuck, modified tummy tuck, kind of talking about contouring or aesthetic surgery of the body, essentially the torso. So I'm going to start by talking about the 3 different surgeries that usually we use for a body contouring. One, the main one, liposuction, tummy tuck, or mini tummy tuck, or modified tummy tuck, or extended tummy tuck. I'm going to go over all these differences. And sometimes the combination of some patient needs combination. Okay, so liposuction, essentially, what are the pros and cons of liposuction? The benefit or pros of liposuction is that incisions are very small, the recovery a lot faster, and you get a lot done through the very tiny incision. We can get a lot of fat out with the liposuction through the very small incision. But the thing with the liposuction is it relies a lot on your skin. So ultimate result relies on your skin, how your skin will retract back. So if you have a good skin elasticity, that liposuction result is going to be great. If not, then the skin might be a little bit loose, which we're going to cover that too. Tummy tuck. Tummy tuck, essentially, it's for moms to have multiple pregnancies or patients that have massive weight losses. So what happens in those cases is that the skin becomes very loose, and in case of pregnancy, the muscle, the abdominal muscle gets separated, and especially after 2 or 3 pregnancies, they don't come back. So none of those things gets addressed with liposuction. And again, I'll show you a picture so you can see. And unfortunately, I always say none of those things get addressed with diet and exercise. Although I always say diet and exercise is great, to tone your muscle, lose weight, stay healthy, but it won't tighten the skin and it won't bring the muscle back together. So in those situations, we need to do either a full tummy tuck, which in that case, or a mini tummy tuck. So what's the difference between the full and mini tummy tuck? The full tummy tuck is addresses the loose skin above the belly button and the below the belly button. So the whole entire skin of the abdomen will be completely tight, and bring the muscle back together. So we can do correct the muscle separation and the looseness of the skin above the belly button. I'm gonna have you, Melissa, can you put a picture on? So see, this will be the perfect example for full tummy tuck. The liposuction here won't do a dent. It's not gonna do anything because the problem is not necessarily fat, it's mostly skin and muscle separation. And in this case, you have a lot of loose skin above the belly button. How can you tell that? Because you can barely see the belly button. When you can't see the belly button, there's too much skin pushing down on the stalk of the belly button. So that means you have a lot of loose skin there. So in this case, we have to do a full tummy tuck and with the muscle separation. Now you can see on the post-op photo how every skin is super tight, and you can also see the shadow of the muscle, how muscle came back together with minimal distance there. Okay, so let's switch around to who's a good candidate for mini abdominoplasty. Actually, yeah, Melissa, go back to that full tummy tuck. I just want to address one more thing. So I rarely just do a tummy tuck by itself. I would say 99.9% of the time I do tummy tuck and combination of a liposuction. And you're gonna have to do it because to create some shadows. And also when we do a tummy tuck only addresses the abdominal box right there. It doesn't do anything to your basically your flanks or your hip line. So I usually do aggressive liposuction on the sides, on your flanks to give you the nice shape. I also do, to bring the waistline in, I use a different also suture technique inside. I want to bring the muscle, I use a different suture to, oh, sorry. Let's see who this is. Potential is spam. All right. And then, so that I do that. And also I liposuction. Now I know this has been a taboo. There a lot of you're gonna see a lot of controversy here that they saying you should not do liposuction and tummy tuck, and it is true and it's not true. I mean, as long as, and I've done a lot of these, as long as you have a good experience and you know how much you do your undermining, you definitely can combine a liposuction and a tummy tuck and get a much better results. And that's why I also liposuction of the upper abdomen, so you can see on the post side, to create some shadows. The other thing I do with the tummy tuck is a pubic area, because if you just do a tummy tuck and ignore the pubic area, it's not gonna look right. Melissa, you know, we have a lot of patients coming in that they had, what do they had? They had tummy tuck, and then they're upset about the pubic area, right? And I'm sure you get a lot of consults, Kim, right? That they just come in that want to address the pubic, because they had a tummy tuck.
They need that lift.
Exactly. So why go back again to do that when you can do everything at the same time? So you do the tummy tuck with to correct the abdominal area with the tummy tuck. You correct the pubic area with the pubic lift and addition of liposuction, and you do some combination of liposuction to create better shape. Because we're not here just to make the tummy flat. We're here to give more shape, okay? All right, so let's go back to the mini tuck. Who is a good candidate for mini abdominoplasty? Yeah, so this is, and again, I feel like, you know, I feel like the mini abdominoplasty is a little bit of misnomer, you know, because patient thinks when you do a mini abdominoplasty, your incision is smaller, it's going to be smaller, and that's not true at all. What determines your length of the incision is how much looseness you have lower under your lower skin. Okay, so going back to mini tuck, so this person is a perfect candidate for mini abdominoplasty, or a modified, I like to say a modified abdominoplasty, because you can see there is not much looseness above the belly button. We can totally see the belly button. There's not much of separation with her abdominal muscle, and but most of the problem area is on the lower abdomen. Okay, and that's what she was very unhappy about, the lower abdomen. So this will be someone that we can do a combination of a liposuction, and in this case, because we're doing a modified abdominoplasty and we're not mobilizing the flap all the way up, we can be very aggressive with our liposuction and not worry about the blood supply or, like, you know, the survivability of flap. So, and that's what we did. But the incision is still is going to be from hip to hip in this case, because look, we have to cover the whole length and a little bit more. Otherwise, she's going to have what we say dog ear. But in this case, we can obviously place the incision very, very low so we can kind of hide it. And you see, we didn't do any full abdominoplasty. We didn't do any muscle repair. But if you look at the post-op, she had a great shape because she was a perfect candidate. Let's switch to someone who's a good just for liposuction. Let's cover that too. So yeah, again, this is again, I'm comparing just moms, you know, in all cases. So you saw 3 different moms. The first one was with full tummy tuck. You see a lot of loose skin, muscle separation, definitely the tummy tuck in addition to liposuction. The second mom was the mini tuck. The majority of the problem with the below the belly button. Now, this is a third mom. So you can see in this case, there is not much, you know, does she have a little bit of loose skin? Maybe a little bit, but that could definitely get addressed with just liposuction. The main problem was her adiposity and fat. She was already in a good shape. She just wanted to get some definition. And she had good skin tone or skin elasticity, minimal muscle separation, very good skin elasticity, that even after the liposuction, you can see her skin totally responded to do that. Melissa, we've seen a lot of people coming in for liposuction, but then we notice that they need a tummy tuck. You agree?
Would be better, yes.
Yeah, and that's another reason it's good to come in for a consultation because so we can address these different issues. Just very briefly on the recovery time. So for the full tummy tuck, the recovery would be about 2 weeks. And then after that, you can do your normal routine, but you can't do any heavy lifting or strenuous activity. For mini tuck will be about 7 days, 1 week. And then for liposuction, it will be about 3 or 4 days. And there's no restriction on liposuction, how you sleep. That's another benefit of, like I said, with the liposuction. But I will have another full podcast on post-op care. How do you manage your drain? The time that you're coming here with us for a post-op visit. So we'll have another full video. All right. So don't forget to subscribe if you haven't already. Make sure to like this one. Definitely write me a comment. Tell me what topics you guys want to talk about in the future, and please share it. All right.